In 2025, healthcare organizations clinging solely to traditional claims editing are not just falling behind, they're actually leaving millions of dollars on the table. This outdated approach, which was once the gold standard for revenue cycle management, is now, honestly, a significant financial liability. Sticking to simple error correction in an increasingly complex reimbursement landscape is, well, like trying to navigate a modern highway with a horse and buggy. The risks of underpayments, denials, and compliance failures have just grown way too large to ignore. Relying on yesterday's solutions for today's problems is really a direct path to margin erosion, a reality that forward-thinking finance leaders are just no longer willing to accept. For years, the industry defined claims editing as the process of scrubbing claims for basic errors before submission. This involved checking for things like incorrect codes, missing modifiers, or just simple data entry mistakes. Its function was tactical and reactive, focused only on cleaning a claim to make sure it passed the payer's initial checks. This was necessary, sure, but ultimately, a pretty limited function. It answered the question, is this claim formatted correctly? But, it failed to ask the more critical strategic questions about financial accuracy and contractual compliance. Claims editing made sure the claim was clean, but it never guaranteed it was correct, or that it would be paid appropriately. Payment integrity, on the other hand, represents a holistic and proactive strategy for revenue assurance. It's not just about correcting errors, it's about making sure the right amount is paid for the right services, by the right party, at the right time. This comprehensive framework covers the entire revenue journey, from the moment a patient is scheduled until the final payment is reconciled and audited. Payment integrity asks deeper questions like, does this claim reflect the true value of care provided? Does it align with our payer contract terms? Are we protected from future takebacks? It really transforms revenue management from a simple administrative task into a strategic financial imperative. The fundamental difference lies in scope and intent. Claims editing is a single, crucial step within the much larger universe of payment integrity. Think of claims editing as proofreading a single sentence for spelling mistakes, whereas payment integrity is like editing an entire novel for plot consistency, character development, and thematic coherence. While a clean sentence is important, it's the integrity of the entire story that determines its success. In healthcare finance, this broader perspective is what separates organizations that merely survive from those that truly thrive, protecting every dollar they are rightfully owed. The shift from basic claims editing to a comprehensive payment integrity strategy wasn't really a choice, it was a necessity, driven by some pretty powerful forces reshaping the healthcare reimbursement environment. Chief among these is, honestly, the relentless pace of regulatory change. The Centers for Medicare and Medicaid Services, or CMS, now updates its logic and payment rules on a quarterly basis, introducing hundreds of new edits and policy adjustments each cycle. A system built only for static, predictable rules just can't keep up anymore. This constant flux really requires a dynamic and intelligent platform that can adapt in real time, making sure claims are compliant not just with yesterday's rules, but with the ones that will be enforced tomorrow. At the same time, claim denials have surged to crisis levels across the industry. Hospitals and health systems are reporting that denial rates are steadily climbing, putting unprecedented pressure on their financial stability. These aren't just simple coding errors anymore, they're complex clinical validation denials, authorization issues, and medical necessity challenges. Traditional claims editing tools are just ill-equipped to prevent these sophisticated denials, since they lack the clinical and contractual intelligence to address the root causes. A broader payment integrity approach is needed to analyze denial trends, identify vulnerabilities before submission, and arm providers with the data needed to prevent them from happening in the first place. Furthermore, the rapid transition to value-based care contracts has really rendered old processes obsolete. In a fee-for-service world, getting paid was about volume and transactional accuracy, but in a value-based world, payment is tied to outcomes, quality metrics, and risk-adjusted patient populations. These contracts demand absolute precision in documentation, coding, and reporting to ensure accurate risk stratification and quality bonus payments. Payment integrity provides the framework to validate this data, making sure the organization is not only delivering high-quality care, but also being compensated fairly for the risk it assumes and the value it creates. This convergence of regulatory complexity, rising denials, and the demands of new payment models created, well, kind of a perfect storm. It became painfully clear that focusing only on the point of claim submission was a losing battle. The industry needed a solution that extended across the entire revenue cycle, from verifying patient eligibility and benefits at the front end, to validating contract terms in the middle, and defending against post-payment audits on the back end. Payment integrity was the answer, providing the end-to-end visibility and control necessary to navigate this challenging new landscape and protect revenue integrity. The adoption of payment integrity isn't just a theoretical improvement, it delivers measurable high-impact results that directly enhance the bottom line. Real-world case studies from 2024 and early 2025 really paint a clear picture of its financial power. One large academic medical center, for example, implemented a pre-bill payment integrity platform and identified over $12 million in potential underpayments in its first year alone. These weren't just simple coding errors but complex discrepancies between their charge description master, clinical documentation, and negotiated contract terms, things traditional claims editors would have missed completely. This really demonstrates a direct capture of otherwise lost revenue. Beyond recovering underpayments, a key benefit is the significant reduction in costly denials. A multi-hospital system in the Midwest provides a pretty compelling example. After deploying a payment integrity solution with a focus on pre-claim clinical validation, they saw a 22% reduction in medical necessity denials within just 6 months. The system proactively flagged cases where documentation didn't sufficiently support the billed services, allowing clinicians and coders to address the issue before the claim was ever sent. This proactive stance not only boosted their clean claim rate, but also freed up staff from time-consuming rework and appeals processes. The impact on value-based contracts is equally profound. Accurate risk adjustment is critical for fair reimbursement in Medicare Advantage and other risk-based models. One integrated delivery network discovered it was consistently underreporting hierarchical condition categories due to documentation gaps. By using a payment integrity tool to analyze clinical data and prompt physicians for greater specificity, they improved their risk adjustment factor score accuracy by 15%. This single improvement translated into millions of dollars in appropriate, risk-adjusted capitation payments, making sure their reimbursement accurately reflected the acuity of their patient population. These examples really underscore a crucial truth. Payment integrity creates value at multiple points in the revenue cycle. It's not just about one-time fixes, it's about building a more resilient, accurate, and financially sound system. The data consistently shows that organizations investing in this strategy see a powerful return through a combination of increased revenue capture, decreased operational waste from denials, and improved performance in value-based arrangements. The evidence is clear. Payment integrity is a direct driver of financial health and sustainability in the modern healthcare economy. To effectively execute a payment integrity strategy in 2025, healthcare finance leaders really have to equip their teams with a new generation of sophisticated tools. These technologies go way beyond the simple rule-based logic of legacy claims editors. The first essential component is a real-time pricing and contract validation engine. This tool dynamically compares every line item on a claim against complex negotiated payer contracts before submission. It instantly identifies discrepancies between the expected reimbursement and the billed amount, catching underpayments, incorrect carve-outs, or misapplied fee schedules. This ensures that what you bill is exactly what your contract says you are owed. Next, a robust modifier and code pair audit engine is honestly non-negotiable. With CMS and commercial payers constantly updating their bundling logic through initiatives like the National Correct Coding Initiative, manual oversight is just impossible. A modern audit engine needs to be powered by artificial intelligence that not only applies current rules but also analyzes historical payment data to predict how a specific payer will adjudicate complex code combinations. This preemptive analysis helps prevent denials related to inappropriate modifier usage, unbundling, and other intricate coding scenarios that frequently lead to payment reductions or takebacks. Another critical tool is a pre-claim DRG and APC verification system. For inpatient and outpatient facility claims, the assigned diagnostic related group or ambulatory payment classification is the primary determinant of payment. A pre-claim verification tool uses clinical natural language processing to review all available documentation, making sure the assigned DRG or APC is fully supported and optimized based on the patient's record. This prevents downcoding that leaves money on the table and upcoding that creates a significant compliance risk, safeguarding high-value claims from both underpayment and post-payment audits. The time for incremental improvements is really over. The financial health of your organization depends on a decisive shift in strategy and technology. Waiting to act means accepting preventable revenue loss every single day. The call to action for every healthcare CFO and revenue cycle leader in 2025 is clear and urgent. You must move beyond the limitations of claims editing and embrace payment integrity as a core strategic function. Implementing this modern arsenal of tools is no longer a competitive advantage, it's the baseline requirement for revenue protection and financial survival.